Okay. Hello, everyone, and welcome to the session on WASH in schools with a special focus on accelerating progress in response to COVID-19. My name is Rick Johnston, and I manage the WHO side of the WHO UNICEF Joint Monitoring Program. And my colleague Tom Slaymaker will be joining us, but is having a little bit of technical difficulties, as is Kellyanne Naylor, WASH Chief at UNICEF. So we're hoping that they'll be able to log on in a few moments. But in anticipation of that, I'd like to ask people to take part of this participant poll that we have set up for you. And in order to do that, it's not through the Zoom platform, it's through the Pathable page for the UNC website or for the UNC conference. And you can probably see the chats on that page, and we encourage you to add your chats to that. But if you could also click on the polls button, you'll see that we've got 4 questions here that I'd like to ask you to take a couple of minutes to answer. And they're about in the country where you work, interest in WASH in schools, investment in WASH in schools, the quality of data on WASH in schools, and expectations about current rates of progress on WASH in schools, all with respect to what's happened because of COVID-19. So let me give people a few minutes to fill out those polls. And I'm not sure if we'll be able to, we will be able to share those poll results. I'm not sure exactly how we'll do it, but we'll work on that while you're filling out the polls. So please go ahead. Okay, I see people are answering the polls. For the first question, it looks like 83% of people feel that the interest in WASH in schools has increased as a result of COVID-19. Nobody has said it's decreased. That's interesting. And there's 15% of people who say that it hasn't changed. As far as investments, it's more of a mixed picture. And I'm sorry, I don't know if any of the administrators can help to share the screens. I'm not sure how to show them, but I'll tell you that about half of people have said that the investment hasn't changed, and 42% have said it has increased, whereas 8% say that it has decreased a little bit. For the third question about the quality of data on WASH in schools, most people, 58%, have said that there's been no change, whereas the balance, just moved up to 46%, have said that the quality has actually increased. And for the last one, about whether people think that current rates of progress on WASH in schools will increase or decrease or not change, we have some optimists among us. It's about 80% who've said that they think that progress on WASH in schools will increase. So we'll keep an eye on those polls as more people answer them, and maybe we'll come back to them later in the session. But it looks like Tom's been able to join. I'm not sure if Kellyanne has been able to join or not. But let me see. Tom, are you able to unmute your microphone? Or Nikki, is it possible to make Tom a co-host if he's not already?
He should be a co-host now. Tom, are you there?
Hi, Rick. Thanks, Nikki, and apologies for the problems with the connection. It seems that we cannot join from UNICEF computers, so unfortunately, Kelly is not able to log in. I can see that she's a participant, but she's not able to join us as a speaker. So maybe Nikki, you could continue working on that and see if you can give Kelly speaking rights. But I suggest we maybe continue with our agenda and get into the discussion while you continue working on that. So thanks very much to everybody for joining. The purpose of our session, as you can see from the agenda here, is to give an overview of the recent JMP Global Update on Washington schools. I'll give you the highlights from that report, which I'm sure many of you will have seen, and then move on to hear some country level examples of how WASH data has been used in response to COVID-19. And then we will move on to a panel discussion about what we need to do next in order to further strengthen the monitoring of WASH in schools in the light of the ongoing pandemic and beyond. So that's the structure of our session in the time that we have left. But I'd really encourage you to type questions into the box as we go along, and we will try and nudge our presenters to answer them. But without any more ado, let's move on to have a summary of the recent JMP Global Update. As I think you know, this is a joint program between UNICEF and WHO. I lead the UNICEF side of the JMP, and my colleague Rick Johnston leads the WHO side. But we are a bigger team, and a key member of the team is Christy Chatterley, who has been supporting us with the production of this report and will be leading us through this presentation. So, Christy, can I pass over to you?
Yeah, great. Thanks, Tom. Glad you're able to make it on. Yeah, really excited to share the latest report from the JMP, the 2020 update. And of course, with all the interest in COVID-19, there's a special focus on that in the report that we'll talk about. So with COVID-19 and with the pandemic, there are a lot of children that are still not in school, and we know how important students being able to go to school is, but the only way that that's going to happen is for them to be able to do so safely. So international guidance for safe reopening and operation really highlights the importance of hand washing facilities that have water and soap, as well as daily disinfection and cleaning of surfaces, but also basic drinking water, sanitation, and basic solid waste management facilities. So really, COVID-19, excuse me, is just a call to action towards a goal that we have already set in the SDGs. We know how important WASH in schools is, and this pandemic is just highlighting that need further. So the SDGs includes WASH in schools under 2 goals. In target 6.1 and 6.2, the language focuses on universal access to water and sanitation. And by that, we mean not only access at home, but also when people leave their homes, when they go to school, when they go to a healthcare facility, etc. And then for the school setting, there's a really specific target, target 4A, which focuses on creating effective learning environments for all. And the target has 7 different elements, including computers, internet, electricity, and adapted infrastructure for students with disabilities. And then the last 3 of those are basic drinking water, single-sex basic sanitation, and basic hand washing facilities. And there's a note that says, as per WASH indicator definitions, and sometimes we're asked what that means. And those definitions are here. So in this first row under basic service, in blue, green, and purple, those are the SDG definitions of basic service. And these were agreed upon by a group of WASH in schools experts, including a representative from UNESCO UIS and national governments. So for drinking water, that definition is there's water from an approved source, and water is actually available at the school whenever the survey or questionnaire was administered. For sanitation, there are toilets or improved facilities at the school that are single sex and they're usable. And by usable, we mean they're available, they're functional, and they provide privacy at the time of the survey. And then for hygiene, the definition of basic service is hand washing facilities with water and soap available at the time of the survey. And then the JMP uses service ladders to monitor progressive realization towards this basic service level and potentially beyond, which we'll talk about later in the presentation. So this middle row in yellow is limited service. And this basically means there's infrastructure, there's some level of service, but all the criteria for basic are not being met. So for example, for water, that may mean there's an improved drinking water source, but water is not currently available. And then that last row is no service in orange. And that means there's either no infrastructure or really inadequate infrastructure in the sense of unimproved water sources like surface water or an unprotected well, unimproved sanitation facilities like a pit without a slab. So in some of the following slides, you'll see these three colors in the charts, either blue, green, purple, and then yellow and orange. And that's referring to this idea of basic service, limited, where there's some infrastructure, but all the criteria are not being met, and then no service in orange. And when we talk about schools for global monitoring, the JMP includes pre-primary schools, primary schools, and secondary schools. So for this 2020 update report, this is the second that the JMP has published. The first was in 2018. And for the 2018 report, we had almost 500 national data sources that we used to compile and create the estimates. For this report, we have 814, so a pretty big jump. I think there's been a lot more monitoring of WASH schools since the SDGs. And so now we have estimates for 173 countries. And on average, there's almost 5 data sets per country that are used to create these estimates. And these sources include mostly education management information systems, or EMIS, or school censuses. We also use data from UNESCO UIS, which sends surveys to governments, and then some nationally representative surveys as well. So if we take all those 814 national data sources, we were able to come up with estimates for basic drinking water in 120 countries and 6 out of the 8 SDG regions, as you see on the left of the slide there. So we need data on at least 30% of the school age population in the region to make an estimate. So those 2 that we have gray bars for with insufficient data, it just means that we had information for less than 30% of the population. If we look at global averages on the right, we estimate that 69% of schools had a basic drinking water before the pandemic, so in 2019. And that left 584 million children without a basic drinking water service at their school. And if we look at trends from 2015 to 2019, we're increasing, we're improving, but it's a pretty moderate pace. So if we want to hit 100% of schools by 2030, as Liz laid out in the SDGs, we'd need a 7-fold increase in that current rate of progress. For basic sanitation, we have estimates for 117 countries and 7 out of 8 SDG regions. Again, if we look at the global average, we estimate about 63% of schools had a basic service before the pandemic. So this left almost 700 million children without basic sanitation at their school in 2019. And we see a little faster rate of progress compared to drinking water, but we would still need a 5-fold increase in that current rate to meet the SDGs, 100% of schools with basic service by 2030. And for hygiene, we have estimates for 110 countries, again, 7 out of 8 SDG regions. Globally, we estimate that 57% of schools had just water and soap available for hand washing before the pandemic started. So that really highlights this gap and this need that really needs to be addressed for safe operation of schools in general, but particularly during the COVID-19 pandemic. So this means that before the pandemic, there was 818 million children that we estimate didn't have this basic level of service at their school. And we're seeing the fastest rate of increase in basic hygiene, but we would still need to increase this 4 times to meet the SDGs for basic hygiene. And if you look at the regional averages, we see a really wide range, all the way from 198%, so nearly universal access in Europe and Northern America and Australia and New Zealand, compared to quite low access in Oceania and Sub-Saharan Africa. And we see similar ranges when we dive deeper and look within those regions at national estimates. So almost all of the regions outside of Europe and Northern America and Australia and New Zealand, the rest of the regions have at least a few countries with less than 50% coverage. Less than half the schools in that country have basic hygiene. Really wide ranging. If we disaggregate looking at income levels, we see that lower middle income countries have achieved the biggest gains in WASH in schools coverage since 2015, but there are different rates in each income level group. And if we dive even deeper and we look not only at the inequalities in WASH in schools between countries, but also within countries, we see further inequalities highlighted. So in this example, if we take that global average for basic hygiene coverage of 57%, and we look at what the coverage is in all the different SDG regions, we see that Northern Africa and Western Asia is actually doing better than that global average. But if we look at the range of coverage for the countries within the region of Northern Africa and Western Asia, we see some countries that are doing, are really struggling with basic hygiene in schools, including the Syrian Arab Republic. We don't have urban and rural data available for that country, but we do have sub-national data for governorates. And we see quite a range of coverage there as well, with 3 governorates shown at the bottom there, where there's actually 0 schools that have water and soap available for hand washing, at least before the pandemic. Hopefully this is improving. If we look at differences by school level, we see that secondary and primary schools have higher coverage than pre-primary schools in Syrian Arab Republic as well. And this is a really common trend. So all the dark circles here represent coverage in secondary schools. The lighter colors represent coverage in primary schools, and these are regional averages for all the SDG regions and then the world. And we see that same pattern. Secondary schools tend to have the same or higher coverage of basic WASH service for all of the SDG regions. If we disaggregate by urban and rural, we also see pretty large differences. We had sufficient data to come up with urban and rural averages for 2 SDG regions. These are Sub-Saharan Africa and Central and Southern Asia. And if we look at these two regions, we see that urban schools tend to have higher coverage than rural schools. And sometimes it's a really big difference, such as in Sub-Saharan Africa. We estimate that almost half of urban schools had water and soap for hand washing before the pandemic, compared to about 1 in 10 rural schools. And that's a very common difference. So if we look at the national level, in most countries, urban schools in the dark circles have higher coverage than rural schools, sometimes significantly so, such as in Uganda and South Sudan. And every once in a while, that pattern is actually flipped, but very rarely. So we've been talking about basic services, and this is, as the language implies, quite basic. So this is a level that hopefully is reasonable, excuse me, and realistic for all schools to meet by 2030. But we recognize that this level of service doesn't necessarily mean that everyone's rights to education and water and sanitation are being met. So we may need to include a higher rung of service in the future, and we're encouraging governments and programs to do so where resources allow. So examples of this might be, you could monitor water quality or the continuity of drinking water. For sanitation, some additional criteria might include student per toilet ratios, which a number of governments are already monitoring. It could include menstrual hygiene facilities, cleanliness, or the accessibility of toilets to students with limited mobility. For hygiene, it might include hygiene education, group hand washing, and menstrual hygiene materials such as sanitary pads. And those are all just meant to be examples. It's not prescriptive or comprehensive. The idea is to identify advanced criteria that are realistic, reasonable, and make sense for that context. So in the next 4 slides, we just have some examples where countries are already monitoring these higher levels of service. This example is from Mali in 2017, and they looked at the accessibility of WASH services to students with limited mobility and found that about 1 in 10 schools had basic drinking water, sanitation, and hygiene, and those services were accessible to students with physical disabilities. So a really big drop from, if we only look at basic drinking water at 70%, basic sanitation at 41%, and basic hygiene at 64%. For an example on menstrual health and hygiene, in Nigeria in 2018, they did a survey that included monitoring if water and soap were available in girls' toilets compartments, a really important element for girls to manage their menstruation, and found that particularly in rural schools, there was very low coverage with only 14% of schools having this service. And based on a survey in Bhutan, which I thought was really interesting from 2018, those physical elements, the infrastructure of having a place to wash and change in private, to dispose of sanitary pads, they're definitely necessary, but the results from this survey show that they're not necessarily sufficient for girls to stay in school. So these are responses that schoolgirls agreed or strongly agreed with, including infrastructure at the bottom. They missed school because there wasn't a place to wash and change, or because there wasn't a place to dispose of sanitary pads. But a lot of girls also said that they missed school because of pain, because they felt uncomfortable, or they're worried about teasing. And then a more COVID-specific example, in Tunisia in 2015, about 1 in 5 primary schools did not have sufficient equipment or staff for cleaning and disinfection. So that's especially critical now, but has always been a need. And if we consider all 3 elements of water, sanitation, and hygiene, similar to the example that we saw in Mali, we find that if we look at schools that have all 3 of those, the coverage drops sometimes quite significantly. So in this far left example from Nicaragua, while over half of schools had basic drinking water service, 1 in 100 had all 3 elements of WASH in schools. And those 3 elements, again, are 3 of 7 in the SDGs for Target 4A, which aims for an effective learning environment. And what we find is that coverage of each of these elements really varies widely between countries, where in some countries like Myanmar in the top left, water, sanitation, and hygiene coverage is actually quite high compared to coverage of electricity, computers, internet, and adapted infrastructure. Whereas in other countries, if we look at West Bank and Gaza Strip on the lower left, we see that hygiene and adapted infrastructure are the limiting factors. And there are a lot more data that you can play with. They're available on the website, washdata.org, then click on data and then schools. You can also download the country files there, which are Excel files that include all of the different data sources that were used for each country, any assumptions that were made, original definitions. So if you want to really dive into a particular country, you can download this file and find more information. So moving forward, I think the first thing we probably need to do is continue harmonizing definitions and address the remaining data gaps where we don't have information on basic service. And one way to do that is to continue integrating the core questions, which are in this document that's linked at the bottom, into national monitoring such as EMIS. And a number of countries have already done this. And so we have really harmonizable, clear data on those SDG definitions. And then we need to get beyond basic and progressively improve services to include things like menstrual health and hygiene, facilities that are accessible to students with disabilities, etc. And the full report, if we were there in person, we would hand you a copy, but since we can't, the full report can be found at that link. Thank you so much.
Thanks very much, Christine. That's a great summary. It's a big report, and there's a lot of detail in there. So I think we'd really encourage you to go and read it and digest it, and come back to us if you have more questions. I see that people have started to type some questions in the chat box, so please continue to do so, and we'll try to answer them as we go along. But one of the things we wanted to do was to hear from the country level about what national authorities are doing to address this issue, both to try and strengthen data on the current status of WASH in schools and to use that to inform the response to COVID-19. And what we've asked is for some of the country teams to record short videos, because they are all in different time zones around the world. And I think what we'd like to do is to try and play them over the platform, but we need to check that that's going to work. So the first one that we have for you is Ecuador, and Ecuador is actually going to be a live presentation. So let's try that one first. And I'd like to turn over to Con van Christ, who is working in the UNICEF country office in Ecuador. Con, can you hear us, and can you speak to these slides?
Yes, good morning, Tom, colleagues from Ecuador. Can you hear me? Okay, thank you. So just sharing shortly with you the experience for WASH in schools monitoring, trying to accelerate progress and response to the COVID-19 from Ecuador. So this is an initiative that has been done in preparation for a progressive return to the schools, as schools were closed in Ecuador as of March 2020. So if you can go to the next slide, then I would like to share with you that initially between the Ministry of Education and the Ministry of Health, there was a specific coordination to work on a protocol. If you can go to the next slide, please. Yes, great. So this protocol for self-care and hygiene for education population during the progressive use of education institutions during COVID-19, during the elaboration of this protocol, it was quite obvious that WASH conditions in schools would be very determinant in the functioning of this protocol. So, and then the Ministry of Education, through the Direction for Risk Management and the Direction for Analysis and Education Information, and also the Direction of Physical Infrastructure, they realized that basically they didn't have information available to know how WASH conditions were actually in schools. So through UNICEF, we provided technical assistance using the reference questionnaire from the Joint Monitoring Program to elaborate an online questionnaire for all the school directors. And the COBO toolkit was used, which was quite easy to use also in rural areas where there was no internet access. So actually the number of schools they wanted to target with this questionnaire was more than 16,000 schools, most of them public schools. And there was an impressive response rate of 95% within a time frame of 15 days. So through this quick online questionnaire, they managed to reach almost all schools in a very short time frame and have an idea on the service levels in all the schools. And if we go to the next slide, which shows the figures that have been published in the latest Joint Monitoring Program report on progress on drinking water, sanitation and hygiene in schools with a special focus on COVID-19. This shows these almost 16,000 schools and their service levels for water, sanitation and hygiene. Interesting there that for sanitation and hygiene, there was also for limited service a difference between limited service because of lack of supplies or because of infrastructure issues. So this was important for the Ministry of Education to know what type of response would be needed to increase the service level for sanitation and hygiene in these schools. And so through the maps you see also clear regional differences. And if we go to the last slide, please. So the perspectives of this massive and very quick monitoring is actually that it's very useful for prioritizing the intervention and mobilizing governmental resources, but also international cooperation, because the evidence is available and specific analysis can be done on that. And for example, we also supported the Ministry of Education for doing a national costing exercise, trying to see what would be the immediate response needed for this progressive return to schools, but also what is the response needed to cover the wash in schools gap towards 2030. This exercise was also very useful. And then through the evidence available, the Ministry of Education also realized that there was a need for a strengthening of capacity at all levels. So a virtual Wash in Schools course was also elaborated and will be available for all teachers in the coming weeks to prepare for the return to the schools. And then finally, something interesting as well, that the Ministry of Education was then also very open to receive further technical assistance to strengthen policies and washing school standards, because they saw that it was very important to work on that and to have specific standards and policies in place, both in emergency situations, but also in regular school attendance. So this is what I wanted to share with you from the Ecuador context. Thank you very much.
Many thanks, Con. That's a great example from Ecuador, which was featured in the report, and it's just a nice example of a very rapid needs assessment that's identified gaps, figured out the costs involved in addressing them, and led to a bigger conversation about increasing standards and maintaining standards during the pandemic and beyond. I'd like to move to the next country case study now, and this one is going to be a short video from Indonesia. Okay, so a very slick presentation from the team in Indonesia, which has been doing some really interesting work, looking particularly at madrasas. So in the JMP report, we generally focus on public schools, so government schools, and it's much more difficult to get information on private schools and religious schools. And so one of the really interesting things that's been going on in Indonesia is trying to integrate the data sets which are available on the madrasas, of which there are about 80,000, with the mainstream government schools, and to put all of that information together into the education management information system. So a lot of interesting work going on there. Now, we're going to have a change of scene and move on next to Germany and to a case study from Berlin.
The Joint Monitoring Program, JMP, provides Germany with good results. 100% of schools provide their students with basic wash services, access to drinking water, access to usable and gender-segregated toilets, and hand-washing basins with water and soap. But with regard to the current pandemic, German schools struggled. The new hygiene regulations posed a challenge to the schools. Hand washing with soap when entering and leaving school premises. The Teltow Primary School in Berlin took action and positioned the mobile hand washing facility Wash-A-Lot 3.0. With the school building more than 100 years old and hosting around 420 students, hand washing before entering school was impossible without major infrastructural investment. Now, with the 4 wash-a-lots in front of the school, an uncomplicated solution has been identified. Students and staff can wash their hands on their way to entering the building. The children love the wash-a-lot. They have fun washing their hands without queuing and in open air.
Wir haben hier an der Teltow Grundschule in Berlin auf jeden Fall gute Gelegenheiten, uns die Hände zu waschen. Wir haben Trinkwasser hier, wir haben Toiletten, die auch nach Geschlechtern getrennt sind. Nur durch Corona haben wir gemerkt, uns fehlen die Waschbecken. Es sind für 420 Kinder zu wenig Waschbecken, sodass die sich nicht alle die Hände regelmäßig waschen können. Deswegen sind wir froh, dass wir die Wash-A-Lots haben. Die Kinder können sich vor dem Unterricht, während der Unterrichtszeit, während der Pause die Hände waschen. Und wir können auf die Art und Weise durch leichte Installation dafür sorgen, dass sich alle Kinder die Hände waschen.
The Safe Back to School campaign is a COVID-19 response initiative under the Green School.
Okay, so an interesting case study from Berlin, and I think we're facing a global pandemic, and of course that's affecting all countries, including high-income countries. And the key message there, I think, was that having access to a basic level of wash services is vital, but it's not enough, and there need to be some additional measures in place in order to keep kids safe, including the installation of the hand washing services at the entrances and in the playground. We have 2 more short clips, and the next one coming up is from Zambia.
Partnership program. The main objective of this initiative is to support the safe reopening of schools in all the 33 wards of Lusaka district by implementing COVID-19 school operational guidelines and national legal instruments for prevention of COVID-19.
We've gone around to check the facilities of hand washing. It's quite impressive to see that there are a number of facilities, different types of facilities, and they are all functional.
Shawama is a school in the peri-urban of Lusaka, and it is one of the schools that is in a green partnership.
Working together in partnership with different other partners within the city, and this is helping us to identify different activities which are happening in schools so that we can provide the necessary measures, intervention measures in this space.
When our partners introduced to us the group hand washing, we did not just sit back and be comfortable with the tool that were introduced.
So for us to intensify the WASH programs in school, we have entered into the partnership program, which we are calling Green School Partnership.
We were here last year, over a year ago now, and we started the group hand washing process from this particular school.
So
name is
Okay, nice example from Zambia with a particular focus on group hand washing as part of a much bigger initiative around clean and green schools. And the last clip, Christy, I think is coming from Mozambique.
I'm Policy and Governance Manager at WaterAid Mozambique. WaterAid Mozambique is working in this country since 1995. I'm going to present about WASH and education in Mozambique in the context of the COVID pandemic, the response given by the government and the challenge we are facing. WASH and education are correlated. SDG 4, quality education, and SDG 6 are interdependent, and both are currently behind schedule. WASH is vital in ensuring education outcomes. A disturbance to either WASH or education can have a knock-on effect on the other. The COVID-19 pandemic has set a new urgent priority for WASH in schools, not just in Mozambique, but globally. After initially closing schools on the 23rd of March 2020, Mozambique is now in the process of reopening schools nationwide. So the response that was given by the government of Mozambique has recognized the importance of the WASH in reopening schools and has set aside 44 million euros for WASH in secondary schools and higher education facilities. A positive and welcome development, however, more is needed to address the Mozambique's 12,000 primary schools to ensure safe reopening. The response must be multi-sector, where the Ministry of Education can provide leadership. The challenge and the future that we see includes one of the largest challenges is the lack of data on WASH in schools. Monitoring and intelligence must be part of the solution. Data in primary school is particularly lacking. Infrastructure for water and sanitation must be followed up with suitable hygiene behavior change campaign. WaterAid Mozambique continues to work with the Ministry donors and other partners to transform WASH in schools in Mozambique. WaterAid Mozambique advocates for sustainable investment to make both SDG 4 and 6 on track. Thank you very much.
Okay, so a series of nice country case studies there, just illustrating the scale of the challenge and the diversity of the challenges faced across such a wide range of different contexts. There's been a massive global campaign, as you know, to get kids back to school safely, and WASH has been a central component of that. In many ways, as Christy said, COVID has shone a spotlight on the situation of WASH in schools, and also the lack of data in many cases on on what is going on, and which will enable us to monitor whether it's getting better or getting worse. And so this is an opportunity. And one of the questions I think that we're going to discuss with our panel now is, how do we maintain this momentum? How do we build on it? And what sort of things do we need to do differently going forward in order to improve the situation on the ground? So with that, I'm going to pass over to Rick, who is going to facilitate our panel.
Thank you, Tom. And it was great seeing those country examples. I really appreciated those. In fact, most of them made some use of data in their analysis and using those data for action. And of course, that's the true value of data, not to make pretty reports or to fill in lines, but to inform policies, programming, and improve services. So those are the topics that we'll address on this panel discussion around data. How can we strengthen the monitoring and the links to action? So let me invite, we have 3 panelists this morning. I'd like to invite Bella Monse from GIZ, along with Julie Watson from the London School of Hygiene and Tropical Medicine, and John Brogan from the Swiss Water and Sanitation Consortium to join us. And I'd encourage all of you watching and participating to share your comments, share your questions, put them in that chat box on the Pathable platform, and we'll circle back to those on the panel. But for now, let me open the discussion with the first question about sharing of Washington schools data. We saw that in some cases, the country example said that there was a shortage of Washington schools data. How can we improve the sharing of the data that do exist among those who can really use it, whether they're national stakeholders or local governments and schools to support local decision making? And I'd like to ask Bella to first speak to that, drawing on your experiences with GIZ. Please, Bella, the floor is yours.
Yeah, thank you. Thank you, Rick. Yeah, thanks for having this interesting question on, and thanks for a very interesting reports before, and Christy for sharing the global data, and very interesting to see that you have far more data sources now. What I think would be good to share is what many countries are currently using to increase the use of data and to have data helping that data is guiding the direction, and also how to use data for improvement in Washington schools is a so-called 3-star approach. I think we have also one slide, perhaps Christy, you can put that up, which could help a little bit. What is the 3-star approach? Perhaps some of you have heard about, which is a system. Do we get that slide in? There's one slide. I thought it would be good to put that up. Yeah, okay. You can see this slide. The 3-star approach is a system which should help schools and should help ministries of education to manage their Wash in Schools program. So the 3-star approach is a system where countries agree on a 3-star matrix, where they make really their priorities and decide on a benchmarking system. And while the SDGs and the targets are global and the same for all countries, the basic service level, the 3-star approach is something where each country can make their individual matrix, their individual, put their own priorities at the front and create their benchmarking systems. And there are countries which have even a 5-star system or a 4-star system or 3 stars, and what countries put at the priority, where they put the first star level is totally up to them, which helps a government to set directions. And if a 3-star system, as you can see here, it helps to orient countries on what is the priority, then you have data collection, data analysis, and then if you have a system in place, it's good to have something like a dashboard where data is made visible so that everybody can see where the status of, let's say, their subnational region is. So they use the data for planning and for resource allocation. Then you look and see that you improve your WINS implementation for the next data collection. Important is that there is a recognition system so that schools can see, or subnational levels can see, that their efforts are being made visible, so that their efforts are being seen and that they're recognized for their good performance. So if you see the next slide, just put the next switch you had in between. You can see this is just as an example. Many countries are using this. This is a dashboard system which is available to everyone. So you can just see how, for example, certain areas, subnational districts are performing 1, 2, or 3 stars, and also how many are not participating, the percentage of participating or non-participating. And one could see, this is an example from the Philippines, which started with something like 60% participation. This is now with nearly 90% participation of schools, and where you can also see the improvements which were made over the last years. So perhaps that helps a little bit to see that I see the big important thing is making the improvements or making the status visible, and use data, use your results, make them visible, everybody can see it, and that this transparency is increasing also the performance in the education sector. Perhaps I stop here not to talk too long.
Thank you, Bella. It's really lovely to see both how transparency is the right thing to do, and also the effective thing to do to improve programming at the local level. So I think those examples of dashboards and data platforms, making the data more accessible to a range of users is really, really inspirational. And of course, in the context of COVID, we started the session by recognizing that COVID has shone a light on the situation of Washington schools and how children and teachers and staff can provide educational services safely. From the poll that we took at the beginning, 88% of people felt that in your countries there was more interest in Washington schools, and about half of you felt that the quality of the data had actually improved because of the focus on COVID. So I want to pivot to a second question about what type of information is needed. And we've been speaking about the core questions. Christy mentioned them in the discussion of the report. Also, Bella showed how those have been mainstreamed into national monitoring systems. But are there things that are not in the core questions? Are there additional indicators or interventions that are needed, in the context of ensuring schools are safe during and after COVID? For that, let me turn to John Brogan with the Swiss Water and Sanitation Consortium to share some of your experiences and perspectives.
Thank you, Rick, and thanks to those who've organized the session and the conference. Thanks for the opportunity for the Swiss Water and Sanitation Consortium to share its experience on monitoring of Washington schools. So there are 8 NGO members of the consortium that have been active since 2011 with the support of the Swiss Agency for Development and Cooperation. And in 2020, we're entering our 3rd phase. And we have 2 signature approaches. One is Washington healthcare facilities, and the other is Blue Schools. Blue Schools means Washington schools, plus looking at other aspects of SDG 6, especially good land and water management practices. For example, learning about the water cycle, learning about where the water I drink, where does it come from, where does it go, water conservation. And the Blue Schools approach itself was articulated into a kit in 2018 by Helvetas, Caritas, Terre des Hommes, and EAVAG Sandek. And this is what we're applying in this 3rd phase in over 140 schools in West and East Africa, as well as in South and Southeast Asia. So if you could show the slide, we have a new monitoring approach for this phase, a new monitoring framework. We use the JMP recommended indicators for basic level wash services. But as you can see on this slide, we were inspired by the service ladder logic to apply that and to create some basic level indicators for hygiene beyond hand hygiene, such as menstrual health and hygiene and solid waste management. And we also use this logic to create indicators for elements that are essential to the Blue Schools approach, like school gardening and environmental activities for youth. So if we look at the slide in detail, for menstrual health and hygiene, and we had some support from CIMAVI on this one, the basic level is that there's at least one private space with water and soap where girls can wash or change, and that there are bins with covers for disposal of sanitary materials. And beyond that, we can look at other elements, like having a separate private bathing area with water and soap, or having sanitary materials that are available for girls for urgent needs. For solid waste management, Evag Sandek led this, and you might see that the basic section got a bit bigger. It looks a bit akin to the Wash and Healthcare Facilities Sanitation section, which is a bit larger. But we really felt that these are the essential points and criteria to be hitting on for solid waste management programming in schools. And so that's that, when we observe, we're not observing litter or waste in the school premises, nor are we seeing signs that plastic is being burnt, that there's separation of organic and inorganic waste, and organic waste is composted. And whatever waste is non-reusable or non-recyclable is disposed of in a protected pit, where it's given to a competent authority for disposal. And so beyond that, into the advanced level, how can we work with communities, with school authorities, and with children to look at reducing waste, recycling waste, and reusing waste? We kept the same service ladder approach. You see the limited is any one of these elements or more of these elements are showing progress on the way to that basic level indicator. And then for the Blue Schools elements, you see that Blue Schools is a process, it's a pathway. So in that little design in the upper right, we take care of WASH needs first. And once those needs are taken care of, we can engage with education authorities and look at their curriculum to see how we can map learning about sustainable land and water management practices. And so two good learning tools are school gardening and environmental activities. And so there we just have the basic level for school gardening, that there is a school garden. Now this doesn't have to be an expansive, massive operation. It could be a very small demonstration plot, 2 to 3 meters in diameter with a central compost basket, and demonstrating how you conserve water by using mulching or other features. And for environmental activities, well, this is whatever is relevant for that ecological zone. Can we demonstrate something on the school grounds or in the immediate vicinity so that youth can understand how we're infiltrating water into the ground with infiltration trenches, or how terracing and tree planting can promote good soil and reduce erosion. So again, these are nature-based solutions that are for the context. We aim, to come back to your question, Rick, directly, we really want to use the momentum of the current focus on WASH in Schools programming and amidst this pandemic to, as you said, look beyond basic, but also bring additional services to the forefront. With Blue Schools, we're learning about WASH, and we're also learning about protecting water in the environment. And so this connection is really important. And so protecting water in the environment, if we see how that's ensured by adequate sanitation, really getting ahead and making a gain on that awareness on the part of the youth and the communities. So what we'd like to do now is, we feel that this dynamic is really helping us to have an opportunity to encourage and inspire the next sector of, the next generation of water sector champions. And we're going to be at this for the next 3 years. We'll see how this goes. We'll be happy to share our results in this space. And if others are interested in these indicators, we'll definitely make them available.
Thanks a lot, John. It's really nice to see that the service ladder approach is seen as useful and being adapted and extended to other settings. I think both in terms, as you put it, of going beyond basic, and we saw in Germany where they had universal basic, there were still additional elements that they needed to take into account for COVID. But this idea of other service areas that are also important to consider and to monitor and plan for, I think it's really nice to see. And just to mention, all of these presentations are available for people to see in the files section of the Pathable platform afterwards. I'm sticking to this theme about what might go beyond basic or be a different type of service area, let me turn now to Julie at the London School and ask about the latest research about behavioral change around hygiene and perhaps around WASH once infrastructure is in place. Could you share with us some of the exciting things that the London School and yourself have been working on?
Yeah, thanks, Rick. So as you mentioned, beyond meeting JMP basic standards on hygiene to have these hand washing facilities with soap and water available, we need to make sure that children actually use these. So we need to promote their use. Traditional approaches to promoting hand washing have largely relied on health-based messaging. So, for example, messaging about the risk of disease associated with dirty hands. But we know from recent studies that health is not a strong motivator of behavior change, and hand washing rates largely remain inadequate. So novel approaches which move away from this health-based messaging and use other techniques to change behavior are needed. One example of a novel approach that can be taken to improve hand washing behavior in schools is implementing environmental nudges. So environmental nudges are small changes to the environment that alter behavior in a predictable way, but they do not explicitly constrain choices. So these nudges cue behavior without people having to consciously engage with them and process the message. Some examples of these are probably a well-known one, painting brightly colored footpaths on the floor leading from toilets to hand washing stations. And that's an example of how you can nudge people to wash their hands after toilet use, and that has been tested and shown positive results, large results in increasing children's hand washing behavior in school. Other examples of nudges include placing eyes above the hand washing station to give people the sense that others are watching them and judging whether they're washing their hands. Placing disgust-inducing pictures on toilet door handles. For example, you can place pictures of germs to nudge people through invoking the sense of disgust to wash their hands, or even placing mirrors above the hand washing station to piggyback the behavior of hand washing onto the habitual behavior of looking at oneself in the mirror, but which might be a more popular behavior. So once drawn to the mirror to look at yourself, you're now at the hand washing station and are reminded to wash your hands. And then even the very placement of objects in the environment can act as a hand washing nudge. For example, by purposely placing hand washing facilities directly in someone's path of movement means that they're highly visible and difficult to avoid, and therefore their presence may nudge or remind people to wash their hands. And one novel hand washing intervention I've personally been recently working on with Save the Children originally is something called the surprise soaps, which are transparent glycerin soaps with toys embedded inside of them, which are designed to get children to wash their hands more often. So seeing these toys inside the soap acts as both a nudge or a reminder to wash hands, as well as an incentive for children to wash their hands in order to reach the toy inside. And these surprise soaps have been tested in a humanitarian camp in northern Iraq, first piloted in 2018 in a control study that found that children who'd received these surprise soaps, the toy and soap, were 4 times more likely to wash their hands than children who'd received plain soaps. So in terms of hand washing, this is quite a large behavior change effect and suggests that using simple nudges and these motivation-based interventions can have a significant impact on hand washing. And we're going on with ACF and Care International to test these further in larger studies. And that's just one example of evidence-based, an evidence-based example of how we can move away from health-based messaging around hand washing and use more novel approaches to encourage children to wash their hands. And I definitely encourage implementers to also give thought to using alternatives to these standard health-based messages in school, especially as the COVID pandemic goes on longer and longer and children become wary and unmotivated by messages telling them to simply wash their hands to avoid catching and transmitting the virus. And just finally to mention, if if you're interested in implementing environmental nudges in school, there's now a guide available to this online. You can access it either on the Susanna website on the Wash in Schools page, or on the Hygiene Hub website, which is housed at the London School of Hygiene and Tropical Medicine. And this guide is aimed to help implementers to decide which environmental nudges are suitable for their particular context, because not all are suitable. And of course, a nudge should come after the meeting the basic standards of hygiene and having water and sanitation facilities. So of course, if there's no water and soap available, a nudge is not yet suitable. And the guide will also sort of tell you, if you can nudge, what constitutes a good nudge, and gives further examples of nudges you can implement. So yeah, it's there if you need it. Thanks, Rick.
Thanks, Julie. That's really exciting. I mean, we know that infrastructure is necessary but not sufficient, but too often the behavioral change communications are not, using the up-to-date knowledge and understanding. These nudges are one example of having a really evidence-based, theory-informed approach to behavior change that also happens to be really cost-effective. So it's like a win-win-win. So thanks for sharing that.
Thank you.
Okay, we're coming to the end of our discussion. I just wanted to look a little bit towards the future then, and we're in a COVID moment right now. Hard to say how long that COVID moment will last, but certainly there's a longer horizon where we're thinking about SDG targets, we're thinking about the next several decades. So the third question I wanted to ask is, how can we make the most use of this moment to keep up the momentum on Wash in Schools post-COVID and accelerate progress towards, SDG targets and longer-term objectives? And any of our panelists are welcome to join in on this, but I'm going to call first on Bella and ask especially about some of the work that you've done among networks in a way of, mobilizing support in the longer term.
Yeah, thanks, Rick. It's also important for perhaps the audience to know that this global Wash in Schools network is existing, and you can just see this. Yeah, you can see this is the some very brief information on the network. It's an interagency network of WINS practitioners and academia and very different organizations, with the goal to harmonize the actions of development partners and together support the governments, as you can see here. Specifically, it's about the supporting the implementation of Wash in Schools, and specifically support the JMP efforts around the world. The network is active since many years, specifically also to prepare so-called ILEs, which means international learning exchanges, and certain working groups. It's much about knowledge sharing and discussion fora, which you can see on Susanna and Yama. And specifically now during the COVID-19 outbreak, the network has invested in a few knowledge products. And perhaps to briefly show the next slide. There is a so-called knowledge map, which you can access on these both websites, Yama and Susanna website. Next slide, briefly. We have this, we developed so-called 10 immediate action points. And I think that has been shown to be very helpful for schools, just on school ground, what is to be done. And these action points are in line with the global recommendations coming from UNESCO, UNICEF, and WHO. Next slide is also then down to the school level, really a checklist, which can be done on certain locations, classroom, school entrance, and toilets. So just to support and give an example for the management during COVID-19. So all these practical tools can be downloaded. And the network is a network of different partners you can see here, but many others are there. These just a few to mention. Thanks a lot, Rick. I'm browsing through that fast.
That's great, Bella. Thanks for going over that quickly. There's a lot of resources available. We have a lot of partners on this call too, so I'm happy that we've had over 100 people participating in this session today. I'm afraid our time is nearly closed, so I'm going to hand back to Tom at UNICEF to close out the session with some final comments. Tom, back to you.
Thanks, Rick. And just to say really on behalf of Kelly, who would have made an introduction, just to thank you all very much for joining the session. And in particular, to thank all of our partners for all the great work that's going on the ground to strengthen monitoring of WASH in schools. We're starting to see in our last report a really significant improvement in both the availability and the quality of data. And we look forward to integrating indicators on some of these new elements in future reports. And lastly, to say to all of our presenters, huge thank you to everyone involved. It's not easy running these sessions virtually, and not all of our presenters could be with us. But thanks to Christy for her presentation. Thanks to the teams from Indonesia, Ecuador, Germany, Zambia, and Mozambique, who will hopefully listen back to this session later on. And thanks ever so much to our panel, to Bella, Julie, John, and to Rick. With that, I'd like to close our session, and I hope you enjoy the rest of your conference. Thank you very much.